Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video we're going to be covering Toddler Developmental Milestones. And this video is part of an NCLEX review series over pediatric nursing. And as always, whenever you get done watching this YouTube video, you can access the free quiz that will test you on this content. So let's get started. The term toddler typically includes children between the ages of 1 year to 3 years. Now in the previous review, we talked about infant developmental milestones, and this included children between the ages of birth to 1 year. So we're at the next step. Now toddlerhood has a lot of changes with it. They are changing physically, especially in the way they look. However, they are changing mentally, and they are developing their fine and gross motor skills. Now the toddler is becoming aware of their environment compared to the infant. So because of that, they want to test that environment out. They want to explore it. And also they are developing this term that I would definitely remember about the toddler called autonomy. And this is where this toddler has figured out, I am an individual, I'm separate from my caregiver, which is usually the mother, and I have my own will. I want to be independent and I want to do things that I want to do. So they will try to test that out. They'll go back and forth between being independent and dependent. Also, they have realized that their actions influence others around them. So really, a lot of things that we're going to be talking about with categories about the toddler that you want to remember for exams is going to be dealing with this autonomy and how we can foster that. Now, the toddler is going to change in their appearance. They're going to lose that baby look to them, and they're going to start looking more like a little child. And as you can see here on the left, here's a picture of a baby, and then 3 years later, this is what they look like. And it's absolutely amazing to see the changes that a child undergoes within that first 3 years of life. Some fine and gross motor skills that the toddler is learning to do is that they are learning to throw a ball to another person. They can also take that ball and kick it back and forth. They're also beginning to learn how to run, and they can climb on things. They can also take like a marker and scribble on some paper. They love coloring and drawing. They may not be good at it, but they like doing it. Also, they like to take blocks and build them. They can also say hundreds to thousands of words, and they can talk in 3-word sentences. Now first, let's talk about the body changes of the toddler that you want to know for exams. So first, their weight. So a toddler by 24 months, so about 2 years, should be gaining anywhere between 4 to 6 pounds per year. So the toddler should be about 4 times their birth weight. So let's say we have our toddler here. Whenever they were born, they weighed 7 pounds. So how much should they weigh by the age of 2 to 3? Well, they should be 4 times that. So 7 times 4 is 28. So they should be about 28 pounds. Now the average weight can vary based on if they're a boy or a girl. So the average weight for a toddler girl that's about 2 years is about 26.5 pounds, and a boy it's 27.5 pounds. Next is their height. So by 2 years of age, the toddler should increase by 2 to 3 inches per year. So a 2-year-old is going to be about half their adult height. And a typical height for a 2-year-old is anywhere between 33 to 34 inches. And then there's head to chest circumference, and this measurement is actually going to become equal at about 1 to 2 years of age. Now remember, with the newborn, the head circumference was actually 1 to 2 centimeters larger than the chest circumference, but around 1 to 2, it evens itself out. Now let's take a deeper look into the main concepts that you need to know about the toddler for exams. And to help us remember those concepts and to tie it all together, let's remember the word toddler. So T stands for temper tantrums. O stands for on the move, and we're talking about safety because remember that toddler loves to explore their environment, so that puts them at risk for hurting themselves. D stands for diaper to potty transition. A big thing that you want to remember about this toddler is toilet training. And then the other D stands for developmental stage theory. L stands for loves to say no. The toddler loves to tell you no whenever you tell them to do things. And this is a term called negativism. E stands for eating plan, and then R stands for the 3 R's you want to remember about the toddler, which is rivalry, and we're talking about sibling, regression, and then ritualism. So first, let's talk about T, temper tantrums. Why do these occur? Well, you've probably heard of the terrible twos, and this is the time when these tantrums like to manifest themselves. And the reason they occur is for several different reasons, but one of the main reasons is it goes back to that autonomy, where the child is becoming independent, they have their own will, and they want to do things, and they can become easily stressed or agitated. For instance, it can be as simple as trying to get into a container to access their toys, but they don't have those fine motor skills to get in there very properly, so they get really mad, they throw it, and they have a tantrum. And they're just really still immature in how they process their emotions. So how a tantrum may look is that they scream, they cry, they throw themselves on the ground, they hit, etc. So where you come into play is with education for the parent. And what you want to educate them about is that this is normal part of childhood and it will go away. Whenever a tantrum occurs, you want to stay calm, even though that's really hard to do sometimes. You also don't want to give in to the child's request of why they're having that temper tantrum, because that's going to teach them that this works and they will keep going back to that. And you don't want to try to reason with a toddler because they're not mentally there to reason with you. They're not going to understand it. And whenever they do this, you want to ignore it, but you want to stay close with them. You just don't want to leave them. Just let them know that you're there still, but just ignore their behavior and protect them from hurting themselves if it's escalating to that point, and be consistent in your approach. Now, what are some preventative measures? Because believe it or not, there are some things that you can do sometimes to prevent one of these tantrums. So a toddler's attention span is really short. So whenever you perceive that a tantrum's coming on, you can actually distract them. So divert their attention to something else. Also, check for triggers. What is something that's going on with that toddler that makes them more susceptible to a tantrum coming on? Like, for instance, are they hungry? Are they sick? Are they tired or overstimulated? That could be something you wouldn't want to do with them. Like, you don't want to go take them grocery shopping with you because they might have a meltdown. Also, giving them choices helps with their tantrums because they're developing that autonomy. So some things that you can do, let's say that they have a tantrum before they go to bed. Well, you can maybe give them a choice. Like, for instance, it's time for bed. We can read this book or that book. So they get to pick which book they want to read before they go to bed. That might help. Also, praising them for their good behaviors so they can start to learn this is good behavior, this isn't so good. And preparing them ahead of time before there's a change in like an event or something. For instance, I can remember with my first son going to the park. They're running, they're playing, they're having fun. But whenever it's time to leave, they don't want to leave. And if you abruptly throw that on them, they can have a tantrum. My son would always just run away, and I would have to run through the park to try to find him. And instead, I figured out that if I prepared him ahead of time, it was so much easier to leave the park. So for instance, you could tell the toddler, okay, we're going to be leaving the park, but I want you to go down the slide 3 more times, and then we're going to go home and get ice cream. Whenever I would do that, it would work like a charm. Next is O, on the move. So we're talking about safety. So our toddler has increased in their mobility. They're very curious and they're into everything. And at this age, there is a huge risk of death where they accidentally hurt themselves. So you want to educate the parent about those things that tend to hurt a toddler. And to help us remember those, remember the word dangers. So D for drowning. Huge risk for toddlers is getting into water unsupervised and they drown. Even keeping your toilet closed, because some toddlers have, believe it or not, drowned in a toilet. A for automobile accidents. So with this, it ties in car seat safety. You want to make sure that the toddler, if they're under 2 years, that they are in a rear-facing car seat, but after 2 years, they can be in a forward-facing car seat, of course, in the back of the car. N is for nose dives, that's falls, accidental falls. G is for getting burned. This can be electrical outlets, can be stoves, anything like that. E for eating toxins, teach the parent to always keep all toxic substances, not only things that they ingest, but things that can get on their skin, away from the toddler. R for revolvers and rifles. These are unsecured firearms. Toddlers are very curious about these things and they can go up and pull the trigger, hurt themselves or hurt someone else. And then S for suffocate or choke. So teach the parent about potential foods that the toddler can choke on, keeping plastic bags away from the toddler that could get around their face, and also knowing how to do CPR to relieve a choking toddler. Next is D, diaper to potty transition. So we're talking about toilet training. Now, in order for a toddler to be successfully potty trained, they have to be physically and mentally ready, because if they're not, it's not going to be successful. And physically ready, what we're talking about are sphincters, specifically the anal sphincter and the urethral sphincter. And these are not really voluntarily controlled until the child's about 18 to 24 months of age. So that's a great time you can start potty training because they're physically ready. Now, bowel control will come before bladder control. And the reason is it's a lot easier to feel when you have to go to have a bowel movement. That sensation is a lot stronger than when you have to void. So most kids are going to be daytime potty trained by the ages of 3 years. One thing you want to remind the parent is that daytime potty training and nighttime potty training are going to be different when the child is independent on it. With daytime, they tend to be a lot faster with that. So with nighttime, going to bed at night, they're probably going to still need a diaper. And most children are trained at about 4 to 5 years of age. So let's talk about those key points that you want to teach the parent about potty training that you may see on an exam. And to help us remember those, we are going to remember the word toilet. So T stands for 2 or more hours with a dry diaper. O stands for on and off the potty by themselves, and they can put on and off their pants all by themselves. I is interested in the potty. They actually are interested in doing this and they want to see if they can. L stands for like sitting on the toilet. This is where they can sit on the toilet for at least 5 to 10 minutes without wanting to get off of it. And then E stands for experiencing regular bowel movements. So they're having regular times that they're passing stool during the day. And then T stands for tells you they have to go. So they can verbally tell you that, hey, I've got to go to the bathroom. Next is D for development stage theory. Now there are 2 theories that you want to know about the toddler's development. We have Paiget and we have Erikson's. So let's talk about Paiget. So with this theory, it really deals with that a person's going to go through these stages, and how they progress through these stages and learn their environment is that they have to interact with their environment and explore it. And they do these in these various stages. So the toddler, depending on their age, because remember the toddler's about 1 to 3 years, that's what we include with this age category, they can be in either the sensory motor or the pre-operational. Sensory motor is birth to 2 years, pre-operational is 2 to 7 years. So some main concepts that you want to remember about the pre-operational is that the toddler has a big problem seeing things from other people's point of view. So they're very much about themselves, so we consider them egocentric. Also, their thinking and how they play and process things is really symbolic. So for instance, if you give a toddler a stick, they may pretend that it's a sword and that the other objects outside are monsters and they're fighting those monsters with their sword. So that's how they process and think and play, which leads me to types of play that the toddler likes to do. And I would remember this. The toddler does what's called parallel play. Now, what is this? This is where the toddler will observe others playing. They will actually go and, let's say, play with some blocks with other children around them, but they won't go and interact with other children, and those children don't really play together in that age category. Now, what are some toys that toddlers love playing with? Well, they love playing with blocks and building them. They also love playing with toys that you can push and pull, because remember at this time, they are really good at walking and they're starting to run. So they love to play with like pretend push lawnmowers, strollers, wagons. They also like to look at books that are interactive, like ones that make sounds or ones that are pop-up, or where you may have to find little hidden things in the book that by pulling up a little cardboard door on the book. Or they like to play with pretend objects like cooking sets, shopping sets, building sets, etc. Now with Erikson's stage of development, you want to remember that the toddler is in autonomy versus shame/guilt. So again, this is where the toddler is transitioning to becoming more independent versus so dependent on their caregiver. And in order for them to have got to this stage, they had to get through that first stage, which was in the infant stage, where it's trust versus mistrust. So they have developed trust with their caregiver. Now they feel confident in being able to try things themselves. Plus, they are now discovering that they are an individual separate from their caregiver and that their actions affect people in their environment. So the result of this stage is that the toddler is going to have confidence in completing or attempting new skills like toilet training, feeding themselves, dressing themselves. And as the nurse who may be caring for a toddler who's hospitalized or educating the parents, you want to do the following. You want to provide opportunities for that toddler to be independent, like those things I just named. Give them a chance to try it. Also, give them choices so they feel like they have a say-so, like choices with their food or drinks or activities or books to read. And giving them positive feedback whenever they do a good job completing one of these new skills. That's going to instill confidence in them. And avoiding punishing them when they do that skill wrong. Another thing you want to remember about the toddler, since we're talking about the development, is separation anxiety. Now, in our previous lecture with the infant, we touched on this because this is when this is starting to happen. But with the toddler, this is definitely something that they can experience. And this is whenever they're removed from their caregiver, they experience severe anxiety and they'll cry and things like that. So what you want to know for exams is that you want to know about these 3 stages of separation anxiety and some interventions to help the toddler dealing with this, especially during hospitalization if the parent has to be removed from the child. So the first stage is the protest, and just as the name says, they're going to protest this. They're going to scream and cry, and it's going to be hard to calm them down whenever the parent has left. Then, if the parent still hasn't returned, they can go to the despair phase or stage. This is the second one. And this is where they have quit crying, they're quiet, but just as the name says, despair, they're depressed and they're sad and they're withdrawn and quiet. But whenever the parent comes back, they're going to cry and want the parent and want to be held. And then we have the last stage, which is called the detachment stage. And it's very rare for a child to actually get to this stage, but if they do, they have detached themselves from the parent to help themselves cope with not having the parent around them anymore. So to you, the child will appear happy, like they've coped very well with it, but in reality, they haven't. And whenever a child gets to this, it can actually affect the parent-child relationship. So how, as the nurse, can you help a child who's dealing with separation anxiety as the toddler? Well, if the parent is coming back indeed at a certain time, you can reassure and remind the child that the parent will be coming back. Also, you want to maintain those routines, that schedule of that toddler. Remember, they love rituals. We're going to be talking about that whenever we get to our R of our mnemonic. And encourage the child to talk about their parent. Then we have L, love to say no. Now, no is a toddler's favorite word. And we term this negativism. This is where a toddler is going to do the opposite of what is being asked. They have a negative response to it. It doesn't necessarily mean they don't want to do it, but they're exerting their independence and they're going to tell you no. So as a nurse, what you want to know about this topic is how to avoid getting that no response so you can get your job done. So you want to avoid asking questions or giving commands where that toddler can tell you no. Instead, you want to give them a choice. So let's say it's medication time. So instead of going to that toddler and saying, would you like to take your medicine now? They're going to tell you no. Instead, you can say, you can take your medicine in a blue cup or a green cup. Which one do you choose? And hopefully they're not going to tell you no, and that will help avoid that response. Then we have E for eating plan. So toddlers tend to be what we call grazers. They just like to snack throughout the day. They're not big about setting down for breakfast, lunch, and dinner with large portions. They do better with small, nutritious snacks. So you want to make sure that they have access to finger foods that are like vegetables, fruits, things like that that they can grab and eat. That's going to help them learn those fine motor skills as well. And you want to avoid a lot of sugary, processed, fatty items. The toddler will love those, but they're not good for them to eat. We want to make sure they maintain a healthy weight. Also, another big thing with the toddler is that their teeth are starting to come in. So we want to make sure that they don't get dental decay. Toddlers can experience this, as you can see in this picture here. So how can we educate the parent on how to prevent this? One big thing is avoiding a nighttime bottle, especially with juice in it, because that is going to set on those teeth and cause them to decay. Also, they need to visit the dentist. A lot of people are shocked that they need to go to the dentist around this age. So this is when the teeth start to come in. We talked about in the infant lecture that those lower incisors tend to come in around 8 to 10 months, the central ones. So by 12 months, they need to visit a dentist. Also, they'll need help brushing their teeth with assistance. They can't really brush their teeth all by themselves. They haven't really mastered that skill yet. And you want to assess their water at home. Ask the parent, do you guys have fluoride added to your water? And if they don't, they may need a fluoride application to the teeth. Another thing about the toddler is that this is going to be a phase in their life where most toddlers are going to be considered picky eaters. They are big about how their food looks, and so they're going to be not very excited to eat a bunch of food. Like if they see that there's large amounts of food, they're going to feel very overwhelmed by that and may refuse to eat it. Also, they don't like their food mixed together. So stir fries where you have rice and vegetables and meats mixed together, they probably aren't going to like that. Or casseroles, because a lot of toddlers, they prefer for their meats to be here, vegetables to be here, and fruits to be here. And some toddlers may go as far as requesting that they don't even touch together. They'll refuse to eat that. And they're going to have a limited selection of foods that they like to eat. They may like to eat just macaroni for breakfast, lunch, and dinner, but hey, at least they are eating. So this is not a time for them to try new foods. They'll probably refuse to try something new, but whenever they get older, they will. And if you're having trouble getting your toddler to eat, you have to think of some creative ways. Toddlers are big on rituals, which we're about to talk about here in a moment. So they may prefer to have a certain plate to eat their food on, or a certain cup to drink. They may want certain foods at certain times because that's what they eat every day. They also, some toddlers like fun, colorful plates that might entice them to eat. So sometimes you have to get creative. Now, because the toddler is starting to eat more complex foods that require precise chewing, they're still learning this skill. So you want to take care to make sure you're not giving them big chunks of meat. So make sure you chop those up, because they are at risk for choking. So watch foods that are stringy, like for instance celery. That takes a lot of chewing and they can get choked on the strings in the throat. Also hard round candies, or even hot dogs, popcorn, etc. And lastly, we have R for ritualism, rivalry, and regression. So let's talk about ritualism. So this is where the toddler wants to do the same things the same way. Now, why do they want to do this? Well, it's predictable, comfortable, and it will actually help promote learning, because whenever they keep doing the same things, they know what to expect, so they feel comfortable to branch out, try a new skill, because it'll help decrease their stress. Because here in a minute, whenever you see a toddler get stressed, they can actually regress and go down in their skills. So know about ritualism. Then we have rivalry, and we're specifically talking about sibling. So a lot of times whenever a toddler, they hit the age of 2 to 3, a sibling comes along, like a brother or a sister. Now this changes things, and we have learned that toddlers really don't like change. They like their routines. So they can have this because of that. Also, the attention's going to be diverted off of them. So what can happen is that the toddler can start having those temper tantrums, and they can experience regression. So what can you educate the parent about on how to decrease this? Well, one thing is to try to include the toddler as much as possible in the care of that baby. Also, try to maintain important routines to that toddler to maintain that consistency for them, because breaking the routine really stresses them out. And watch out for jealousy on the part of the toddler, because some toddlers can become so jealous that they may physically try to hit the infant. And then finally, regression. What is this? Well, this is where the toddler actually reverts back to like infancy type skills. For instance, let's say that they've learned to be potty trained, but all of a sudden they're using the bathroom on themselves. Or they were feeding themselves just fine, but now they want a bottle and they refuse to eat, or they're not sleeping at night, or they're talking like a baby, wanting a pacifier, etc. So why does this happen? Well, toddlers learn differently than older children and adults. Toddlers have these bursts of learning in certain stages, hence these milestones, why we can measure and say toddlers should be doing this at this age, etc. Compared to like an adult who builds upon their learning, and they are mentally mature where they can deal with the stresses and failures of not getting that skill right then and there. Compared to a toddler, whenever they're getting overwhelmed and stressed or something stressful going on in their life, they will revert back to like infancy type skills. So some causes that can cause this is that they have a change in their routine. We've learned that routines are so important for toddlers. So if that sibling comes along, or they're hospitalized where things aren't going the way that they go at home, that can cause it. So anything that causes stress. Also, overwhelming them with a new skill where they feel like they just can't get this skill can also cause them to do this. So what are some things that we can do to help the toddler who is going through this? Well, one, we wouldn't want to punish them for not being able to do something, or if they have reverted back. It's going to increase stress and make it worse. Looking at what's causing this regression, possibly being able to remove it or alleviate it so they're not going to be regressing as much. Not taking the time to teach them a new skill. This isn't the time to do that. So let's say they're hospitalized and they're losing their skill of potty training. You wouldn't want to try to potty train them again because that hospitalization is causing that. And taking the time to praise them for what they are doing well instead of focusing on their regression. Okay, so that wraps up this review over toddler developmental milestones. And don't forget to access the other videos in this series and to take the free quiz that will test you on this material.